Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Delighted to be broadcasting live with you from the Doll Simons Family Studio on this yet rainy, a little chilly Thursday morning, but I think the sun's around the corner. The weekend looks pretty good. You didn't know you were tuning in for a weather forecast, did you?
That's right.
Hey, today we're joined by Dr. Annie Wishna. She's one of our outstanding ophthalmologists, and she's come prepared to talk about the impact of COVID-19 on our eyes. You've heard us all talk about wearing our eye guards, making sure we wear our eye shields and all that stuff. I'm trying to pull it out of my pocket. Wait a minute, I can get it. I'm usually quicker than that. We can always get them on. There we go. And we do that to make sure we stay, when we're around patients, protected from COVID-19. So we're going to talk with her a little bit about the effect of COVID-19 on the eyes, and I think that'll be a really important and insightful conversation. But first, Hawk, how are you doing on the numbers today?
And everyone can wear these when traveling on the airplane.
I'm going to.
Yes.
I may have my first airline trip. It's coming up. I need to go see my sister. She lives out in California.
Yeah.
She and her husband, very good folks, need to head out there. And hoping to do that here in the next few weeks. So looking forward to that.
That'll be good.
But I'm going to wear my eyes, going to take my disinfectant, wear my eyes. I'm going to wear my eye protection beyond my glasses.
Yeah.
And I'm going to, do all the things you've taught me to do.
Yeah, well, again, I think the overall numbers in the United States are not the best. They have been better as far as new cases per day.
Yeah.
The rolling 7-day average still is in that mid 60,000.
But up by 19%.
Yeah, I know.
19%
That's
across
scary.
the country. Michigan's doubled again.
Yep.
I mean, things rising. Minnesota's rising. I mean,
younger age groups too.
and the variant. Dominant pattern is the B117, I think.
It did, yeah, you're exactly right. So in the Kansas City area, we're still doing fairly good as far as new numbers. What we have today at the health system is 8 acute infections with 2 in the ICU, but both of those patients are on the ventilator, so pretty sick. We have 18 in that recovery period as well. In Hays, it's still holding, lower, but they do have 3 active infections and 1 recovering as well.
And how many influenza cases do we have?
I think we've still had 0.
So let's just be clear. Influenza is not coronavirus.
No, absolutely
got
not.
that one down now,
Yeah,
right? Hopefully
that's
everybody
right.
believes that. So, Hawk, a couple of big things happened yesterday around vaccination. So, in Kansas, you don't have to worry about what county you live in. You can go anywhere and get a vaccination in Kansas. So that's a pretty big deal. And if you work in Johnson County, even if you live in Missouri or Iowa or Mars, you can come get vaccinated.
Right.
So that's a pretty big deal. Now, that's unique in Johnson County, but they'll take anybody who works in Johnson County can be vaccinated in Johnson County. So that's a big deal. And then if you live anywhere in Kansas, you can go anywhere in Kansas and get vaccinated. Both of those, I think, are positive steps forward and reflect the increasing level of vaccines that we have. We have thousands here at the health system. So make sure you look at MyChart if you're one of our patients to make an appointment. And if you're not one of our patients, or if you have a hard time with electronics, you can call 913-588-1227. And when you do that, you can get signed up for a vaccine, or you can go to kansashealthsystem.com/vaccine. Really important, folks. Go get vaccinated, because the data we're seeing in the New England Journal had a couple of good articles that came out yesterday, a great podcast about it. And again, those are all open source for the public to take a look at. Important stuff coming out of that, though, Hawk.
Yeah, the vaccines are providing immunity even against these variants. Although looking at neutralizing antibody, it looks like maybe less total neutralizing antibody for some of the variants compared to the vaccine strains, but it does offer protection. And I think even more important, because what we saw earlier when vaccines were being rolled out, and this was because we didn't have a lot of vaccine supply, but a lot of people were deferring or delaying their vaccination. But we're seeing more and more evidence that people, even who are infected and then get their vaccine later on, they do have higher amounts of immunity to the circulating strains. So that's an important thing to note. So even if you had it,
South African, which I think is it B351? Is that the right number?
Yep, B1351. We can elicit, a little bit lower antibody responses, but we still have the T cell responses. We know you can still get really good immunity from getting the vaccine, even if you've had COVID. So it's really important, if you've had the infection in the past, especially mild disease where you aren't too sick or you don't have to go to the hospital, it's important to get that vaccination.
The good news is, too, that we're seeing, and this is called the vanguard of vaccinations, those who got the vaccine first. So that's been really 6 months ago, and from research studies almost a year ago now, had the first doses of Moderna and Pfizer. And what we're seeing, at least at 6 months, and people who people who started the vaccination 6 months ago, they still have high titers of neutralizing antibodies. They may not be quite as high as it was right away, but they're more than high enough. And so pretty impressive data. In fact, when listening to the podcast, one of the things that two folks were saying is that we're beginning to feel a little more comfortable that this is standard viral behavior. And that means our vaccinations should be really effective. And it looks like a booster once a year they're predicting may be the way to go. So that would be great news. Or if we need to reconfigure those in order to deal with the variant. But they're saying, gosh, look at how successful the vaccines so far are against the variants, especially Pfizer and Moderna, because that's what we have the most data on so far.
We need to get more Johnson & Johnson. But again, there continue to be conserved areas that we develop an immune response to on that spike protein as well. So we're just looking to continue to get more information from the Johnson & Johnson as well.
The vaccine for the world, the one that's supposed to have the most doses given ever, is the AstraZeneca vaccine. But more countries are now limiting it to those who are the most at risk because of the concerns about clotting. Do you have thoughts about that?
The latest thing I saw was that they were basically making the age cutoff. Sometimes it's 50, sometimes it's 40 from what I've seen in some of these countries. So, it's still an effective vaccine. There were those, fairly rare cases when you think about how many vaccines, in fact, I think the CDC said very rare, about the blood clotting, which of course is a significant issue. Don't know the mechanism yet, but do understand that maybe, using it in people above a certain age is probably where a lot of these countries are going.
And I think it's not so much that we want to put people at an older age at risk. I think some countries are even over 60 now, but rather that the risk of death from coronavirus and those less than a certain age, like let's say 20s and 30s, may be out. The risk of the blood clots are very low, but the balance is a little more disturbed if you're younger. The reason to be vaccinated if you're younger is really to protect against yourself from coronavirus, protect against long haul syndrome, and to protect against those who you care about and who you're going to be around. And so it appears that the balance may have shifted a little. So we'll have to follow that very closely.
Absolutely.
All right, let's see if there are reporter questions out there today.
Good morning, Cody Holyoke from Channel 9.
Hey, Cody. Welcome back.
Hey, thank you. A couple of quick questions. First, how is the interest in the vaccination clinics that you guys are opening up to the public? And then secondly, and this doesn't just count Douglas County, but we're seeing a lot of rural counties, and we've seen this off and on for the past couple of months, put out tweets or announcements, hey, we've got 1,500 doses available today. Everybody, all hands on deck. Is that a more common occurrence that you're hearing about throughout Kansas? And how do you, just peel back the curtain for us, how do you get the shots in arms at that point?
Well, I'll tell you what, Cody, those are great questions. Yeah, so we have, yesterday we had 8,000 doses available this week, and I think that's a big number, and I think that's where we are. I think we've got some of those delivered. I don't know what the exact number is we have today. We still have several thousand, I know, doses available. So plenty of doses to be able to give to folks. Vaccine hesitancy is real, and I think that the best way to deal with that is to develop a system of care in which vaccine can be given more through physician offices and places that patients go to. We talked yesterday about some consulting work that came out a few weeks ago that demonstrated that the place where patients will get, even those who are vaccine hesitant, and that tends to be more centered in rural areas, but it can be in urban areas as well, especially in Black and Latino and Latinx populations. When you ask people who are in immigrant populations, and people say, well, should we vaccinate immigrants? Well, it's a public health crisis, and in that situation, you want to create herd immunity, and the way to do that is to vaccinate everybody. And so how do you convince those who are vaccine hesitant that, A, it's okay to come get a vaccine, that you're not going to get deported, 2, that we're not here to experiment on you, that 3, that it actually works and it's not a hoax, and that 4, this should not be a political divide. And I think the best way to do that is through a doctor-patient relationship. And so evidence is overwhelmingly clear that the best way to get vaccine-hesitant individuals to get a vaccine is to have discussions with their physicians and try to administer that vaccine in the physician's office. I think you'll see us move to that more and more as time goes by. The problem has been that Pfizer and Moderna vaccines, because of their cold storage, and once you thaw them, the limited time you have to give those vaccines makes the logistics of vaccination more difficult. We have to design systems around that, and we're working on that for our own clinics here at KU, so that when my patients with cystic fibrosis who may be hesitant, or anyone else who I see, come to my clinic in the pulmonary disease clinic here, I'll be able to offer them a COVID vaccination. To date, don't do that because I don't have it. I can get them scheduled into one of our other places, but it's hard to get them scheduled within my own clinic. But I think you'll watch that change over a few more months because we know that that's the way to administer vaccine. We've got to administer it in offices. Johnson & Johnson is also true. That it will work great in offices. We don't have the Novavax out yet. I'm not sure if it's going to have to be protected or not, and I don't know the fate of the AstraZeneca vaccine in the FDA. So as you look at all these statements, what I think it adds up to trust. And what we have to do is create trust between those of us who want to get vaccinated and those who are hesitant. The other thing I think we have to do is we have to be honest and transparent about the side effects and how important this vaccine is to every population. And for those who are suspicious of healthcare, we have to work through either churches or other social organizations or federally qualified health centers, county health departments, wherever we can go to find people who either don't want to be found or who have distrust of some other governmental institutions. So that means it's going to take a wide-ranged approach. What I also hope, and this is a hope, and I don't know if it's true, but I hope that it is true, and I believe it will be true, as we watch people who are vaccinated be protected and those who aren't still get sick, I think it will add weight to the argument that we all need to be vaccinated. And I think that's going to be a longer-term process, but I think it will be true. It's been true in other epidemics and other diseases that we've seen. So I believe that it will be a multi-pronged approach between vaccine in offices, creating trust, vaccine in different type of public places or institutions like churches and other types of places that will allow us to reach into populations who may not have trust of other folks or other institutions. And then I think the weight of evidence that shows that the vaccinated are healthy and the unvaccinated are sick, people are going to say, gosh, I need to get that shot. But that will take a longer time. Hawk. Long-winded answer, Cody, but I'm famous for those.
Yeah, I mean, I think we have heard some talk about that, and as other counties are also maybe reaching their so far maximum amount of people that have been vaccinated, able to distribute to other counties as well. So I think there's a lot of factors there, but the important thing is to continue to give those good messages because we really want everybody vaccinated, and that is going to help overall the economy, continuing freedoms, lessening restrictions, being able to meet, doing all those things. But right now it's still vitally important that we continue to do the things that we've been doing, and that's masking, not meeting in large groups, but also continue to be proponents of the vaccine because so far these are shown to be safe and very efficacious. And we can see that, and it may not be in the number of cases per day because that may be maybe not true because people are maybe not getting tested as much, especially if they have a little bit of fatigue or fever or cough. They may assume they have it, not going to get tested. What the real mark that we're probably trying to find, and Dr. Wild mentioned this last week, is probably the hospitalizations. So these vaccines, we know they protect people against hospitalization and death, and that's why it's all the more important to continue to monitor hospitalization numbers, but also get those vaccines into arms.
Cody, anything else?
Nope, thank you.
All right. And thanks for not affirming my long-winded answers, Cody. It's true. Next, any other questions out there?
Yeah, hi, it's Lindsay from Channel 41 here.
Hey, Lindsay.
We found a recent poll, I think it was from NPR, that said 1 in 4 people don't want the vaccine, just like you guys are talking about vaccine hesitancy just now. What happens if we start to stall at 65%? It's not the 80% for herd immunity, but we just get to a place where the people who are going to get it have gotten it. What happens to
Yeah.
life, community spread? What does that look like?
Yeah, that's a great question. Here's what happens, I think. Two things. First, many of the people and the evidence I've seen and the research I've seen that are vaccine hesitant, that 35% are also those who don't wear masks. So a certain percentage of those people will have had COVID. And so that will create some immunity, perhaps not as good against the South African variant. The data is beginning to suggest that the South African variant is not the wild type coronavirus, which is the one most of people have had up until now. That infection may not protect you as well against the 1351 variant, which is the South African variant. And so my statement may not be completely true if we have a big spike in that. But in general, if you've had COVID, at least for 6, and we probably believe 8 to 12 months, or if you've been vaccinated, you'll be part of the herd immunity, and we can see a decrease. So even if it's 65% have been vaccinated and 35% haven't, if some percentage of that, let's say it's half, have been infected, then we're closer to 75, 80, 85% of people have had it. And that's a pretty good number to see the things drop. The problem will be that there will be a pool of people who will have not had it, who can then continue to transmit it, the virus continue to mutate, and that is a danger to us all. And that's what we have to say out loud. It is a danger to all of us, ultimately, if people will refuse to be vaccinated. So I think what we will find is that more companies and more hospitals and more other groups will begin to say vaccination is mandatory. We do that with the influenza vaccine. We do that with other vaccines, MMR and things like that. And so I would not be surprised once we are fully apprised of the safety and efficacy of COVID vaccination, that because of the threat to the health, just like there's a threat from polio, there's a threat from measles to everybody's health, that we may see a rise in a more public health policy centered around, mandatory vaccination. And people are afraid of that, but we already do it, right? Mm-hmm. Influenza is mandatory for many businesses across our country and many other in jobs and places of work. I mean, we require influenza vaccine here. Yeah. We have not made the step to require COVID vaccination here because it's not a fully authorized drug yet by the FDA. However, I have to say, if you begin to see it, there are about 5 to 10% of hospitals that are now requiring COVID vaccine, and that number is rising. And we fully expect Pfizer to go in and Moderna to be closely behind sometime in the next 3 to 6 months and go in for full FDA authorization. When that happens, I think it's a lot easier to require drugs, or require vaccination. So I think you're going to watch this story evolve, because as long as there is a pool of people who have not been vaccinated and have not had coronavirus, they don't mean to be. I don't think anybody means to be a threat to anybody else. But that's where coronavirus can live, spread, and mutate. And when it mutates, then it does become a threat again to all of us, Hawk.
Yeah, and there continues to be a growing, stronger signal in the data that vaccination is the way out of this for everybody. And what I mean by that is that we have more signals from the data now, from the published reports, that the immunity you gain from vaccination is much stronger than the immunity you gain from even wild type infection. So, but you touched on a good point. I think the point that I was going to say was that what does it look like if people continue to be hesitant and large swaths of the population don't get vaccinated? I was going to say virologically, it does mean you have an increased risk of creating these other variants, because every time the virus gets into a new host and starts to replicate, you always have those chances for new variants to arise, and that is the biggest thing, and that is why vaccination is so important, to help reduce the overall replication in any one individual, and thereby decreasing the chance that they may develop new variants on top of the variants that we already know about. I mean, we've seen in India, they already have this double mutant. Of the, I believe it was the three, it's a kind of a combination between the 351 and the California variant. So we've seen it happen. It happens in the real world. Vaccinations are our way out of this pandemic and continuing to life more like normal in 2019 than it was in 2020.
And if people want to know more about those variants, I invite you to download the New England Journal of Medicine podcast from today or yesterday today. But it's free and open to the public, and so and they don't just use scientific speak. There's a little bit in there, but it's a pretty good discussion about this very point.
Mm-hmm.
And I think I'd invite everyone to take a listen to that. It's very helpful. Other questions?
I had a quick follow up to that.
Please.
Sorry, two parts. So just hearing you guys say it's a danger to everybody. If I'm someone who doesn't want to get the vaccine, and my thought is, if you want to get it, that's fine. You get it. You're protected. Don't worry about me. You know what I mean? So what would you say to someone who thinks, how can I be a danger to someone who's vaccinated? Does that make sense? And then also, what do folks do if they lose their vaccine card? We had that question.
Yeah, you know what? We still gotta go. I don't know what we do when we lose our vaccine card. If you're our patient, you can get to the information in MyChart.
Yeah.
So I think if we ever move to vaccine passport per se, we'll have to have something better than that little piece of cardboard we handled, which, by the way, was in my back pocket and got washed, and it's kind of hard to read right now. But I can get it off MyChart. So or I can get proof of my vaccine there. But I don't. We'll have to figure that one out. To be honest with you, let us work on that question. That's the second time that question's been asked. The second time question I've said I don't know because I didn't research it, so I'll go find out.
Dr. Stites?
Yes.
Tell them to take a picture of it, because nobody loses their cell phone.
I know. Well, I didn't do that.
And everybody's tracked on their cell phones anyway.
I know.
So we all have.
No.
Download that.
So, okay, the first question, though, what do we tell people who don't get vaccinated, or really are they the threat? So here's the problem. If I haven't been vaccinated and I don't want to do it, I don't really feel like a threat because I'm just one person. I'm not a threat. The threat is a public health threat because the way the virus works is that when it reproduces is when it mutates, and it only can reproduce inside a host. So if you are protected by vaccination, the virus really can't get in you and it can't reproduce because your body attacks it so fast, so it can't. I mean, the odds of mutation drop dramatically.
Yeah.
So the problem is if you haven't been vaccinated and you get infected by the coronavirus and it mutates, not only can you give that coronavirus to someone else, but if the mutation is somehow different that the vaccination process doesn't recognize, then the vaccinations become ineffective. Then you can infect everyone, and we have to start all over again. No one wants to restart the pandemic again. No one wants to go back to full-scale lockdowns. None of us want to have to shut down our surgery schedule again. Those are all really bad things. So for one person to say, I don't want to get a vaccination, you know what, I understand it. It's a little scary, and some people just don't ever get a vaccine. But from a public health perspective, that's a really bad answer. Yeah. And what you have to think about is, what does it mean to the rest of us if because you don't get vaccinated, that mutation is in you, and that mutation is then spread, and it becomes the dominant strain, and we all go back down to lockdown. And I think that's the gamble we have when people choose not to vaccinate. And that's the reason measles vaccine is required in schools, right? And so I think that's how we have to look at it like that, is when you have a really dangerous agent that can infect you and kill you, that we have to try and do all hands on deck because we have to take care of each other. That is our social pact. And I don't know of another way to describe it than that, Hawkeye. Any thoughts that you have?
I think we have to understand what are the individual reasons. Is it I just don't like vaccination? Well, I would encourage everybody to, if they're above 50, to get shingles vaccination because nobody wants shingles. That causes
that's really painful.
A lot of pain. It can last for a long time. So be consistent in what you're doing. Are you saying, well, I don't want medical treatment if I have cancer? I'm not going to do that. I don't believe in the medicine. So there are various reasons. But the other thing is individually. If you've been infected with coronavirus and you don't want to get the vaccine because you didn't have a very bad disease, that's great. But we know that other variants are out there. Again, the data is still varying about does it cause more severe disease? Is it more easily transmissible for any one of these variants? But we still don't know exactly what happens when you get reinfected. There are cases where people have done well, and there are cases when people do worse after reinfection. So the other thing is, individually, will it protect you from possibly getting worse disease and going to the hospital? Will the vaccination protect you from being able to having to miss work because you're ill, because you've now been reinfected with one of the variants. So I think there are various reasons, and you really have to ask the individual, what is your reason why you don't want to get vaccinated? Because we have points, counterpoints, and arguments for all of those. But overall, to your point, as a society and as a nation, we are going to be much better off the more people that get vaccinated.
You know, and the good news is, as in some ways, I think, the difficult, bumpy road the United States had throughout the first phases of this pandemic, and as hard as it's been to get all the vaccine organized, as we've said all along on this program, the real problem, we didn't have no vaccine. We are doing a lot better now than a lot of places, and we are really on their way back.
Yeah.
So don't fumble the ball here in the fourth quarter on the goal line when you're about to win.
Yeah.
Don't fumble it. That's a really bad plan.
Yeah.
We've come a long way, and we went through a lot of hardship, and a lot of people have died. Over 600,000.
You know, I think Israel is still doing well. We know they have a very good amount, high percentage of people vaccinated. But look at the countries in Europe now that are having to go back into lockdown, or their hospitals are over capacity, or in Brazil, those things that are happening there where they don't have the vaccines that the United States has and any one of our local communities has. So I would advise everybody to take advantage of those, really to protect yourself individually, but also those around you.
Yeah, it's predicted that Brazil, with nowhere near the leading population in the world, will surpass the United States, have the highest number of cases and the highest number of deaths throughout the world. So it's, you know, it's like, you know, you can't drive your car through a stoplight. You can't just go out and shoot somebody. You can't. Well, you're not supposed to, and you're not supposed to, you know, you have to wear no shirt, no shoes, no swords. I mean, there are certain rules in our society. And I think we'll just have to, at some point, especially when we know the drugs are fully safe and effective, and they're fully FDA approved, we're gonna have a hard public policy debate. And you know, I can give you the medical answer. Fortunately, we elect people to go in and make some public policy decisions that are going to be faced with this as a public policy decision, I think.
But as far as safety, we heard, we had said this a couple weeks ago, and Dr. Pollan reaffirmed that this week from Mayo Clinic. That debate about the safety of the vaccines,
It's over.
is really diminished and is nearly gone. You know, again, we did discuss some of the AstraZeneca. Well, right now we aren't using the AstraZeneca vaccine.
Yeah, I'm not sure we ever are.
But Johnson & Johnson, Moderna, Pfizer, those vaccines have really shown to be safe. So I think that's it.
Other questions out there? I'm going to now turn to Dr. Annie Wishna. Welcome to our program. Thanks for letting us hearing us debate all about vaccination today. So, can you get COVID via the eye?
Well, thanks so much for having me on the program. So yes, you can get COVID through your eyes. That's why we all wear our
protective eye gear. Yep.
In the healthcare system. Your eyes, the white part, the pink part, the conjunctiva, it's just like your mouth and your nose. It's a mucous membrane. It's not like your skin that's impenetrable. So if virus particles are in the air or talking to someone and that lands on your eyes, you can get infected. Or if you touch your hand, you have virus particles in your hand and touch your eye, you can get infected that way as well. So that is how you can get it through your eyes. So, you know, we wear them in healthcare because we're in a situation where we can have our masks, but we can't always social distance. You know, I have to get 8 to 10 inches from my patient to get a good look at them. And all day long in that situation, you know, I wear these to protect myself. If I'm going to the grocery store or, you know, sitting outside with friends and I'm able to social distance, of course I'm wearing a mask, but I don't wear this eye protection all the time. If you're in a situation where you're unable to social distance for a sustained period of time, say on public transportation, or if the CDC says if you're vaccinated, you can travel, you're on a plane, so I would definitely wear eye protection. And you can get, you know, these are ones I got from our optical shop. These are safety glasses that wrap around.
Yep.
You can get a pair like this at Home Depot, Lowe's that are a couple dollars. This is going to be just as effective. Or, of course, a face shield would be effective as well.
So good stuff. Mine came from Amazon, and I think they cost me like, $3, something like that.
Yeah.
They were great.
Yeah.
Okay, so is it safe to wear contacts?
So, yes, I actually wear contacts. I'm wearing them right now. And there was a study out of China showing that people wearing glasses were less likely to get COVID, but it wasn't really clear what the correlation was there. Really, you need eye protection that wraps around. Glasses by itself aren't going to do it. I think it's more just if you touch your eyes a lot when you're wearing contacts, I don't. One of the technicians in our office, she noticed that when she wears her glasses, she actually touches her eyes a lot more because she's adjusting them or pushing her hair out of her face. And she realized when she wore contacts, she actually touched her eyes less, and that was safer. So really, it's just don't touch your eyes.
Don't touch your eyes. And so can COVID impact eyesight?
Well, yes, it can. The two main things that we know about COVID, how it causes so many problems in our bodies. One is it can cause vascular occlusion, so blockage in blood vessels. So that can occur in the eye, in the retina, which is kind of like the movie screen of the eye. You can get a blockage in the vein or the artery, and that can cause vision loss. There have been some cases of COVID that have presented in that way. Also, vascular occlusion, if that occurs in the brain, that's what a stroke is. And the vision system, it's processed through our whole brain. And also the muscles that move the eye, they're powered by individual nerves that come off the brain. So with a stroke, you could have areas of vision loss or double vision. So it can cause problems in that way. The other big thing is the body's inflammatory response. So there have been cases of optic neuritis, inflammation of the optic nerve, and other forms of inflammatory conditions that affect the eye.
Yeah, that's pretty amazing, isn't it? That it can do the eye, it can do everything else too. So, all right, do you have any complaints about people who wear masks and what that does to their eyes somehow?
You know, I have some patients that say that, their breath is hitting their eyes. If they have dry eye, that irritates their eyes. Of course, if you're wearing glasses or eye protection, it can fog up the glasses. There have been increased amounts of trauma in jobs like construction where people need to wear eye protection. They take it off because their eye protection gets fogged up, and that's when some crazy accident occurs and they have a serious eye injury. So some tips to kind of keep your mask from, or your goggles or glasses from fogging. You want to make sure your mask fits well, especially up here around the bridge of your nose. You can use surgical tape to tape it down. You can kind of tuck your mask up underneath, pull your glasses down the bridge of your nose a little bit so the nose of your mask is underneath, and that creates a little seal. And also washing your glasses or goggles with soap and water or an anti-fog spray can prevent fogging as well.
Yeah. So COVID and long haul syndrome and the eyes, besides you mentioned the vascular occlusion, anything else to be thinking about?
I haven't seen this in the research, but anecdotally, I've had a lot of patients who had pretty severe dry eye after COVID.
Interesting.
And I'm not really sure why that is. Maybe they had a mild conjunctivitis associated with their COVID. They didn't really notice because they were sick otherwise. But that can manifest as blurry vision that comes and goes, or burning in the eyes, and just using over-the-counter lubricant drops 3 or 4 times a day can be really helpful with that. If that's not helping, you can come see your ophthalmologist, and there's more we can do for that. But that is something that can really interfere with quality of life, so it is something worth getting addressed.
All right. Well, great. Well, thank you for staying. Now, you have to stay on the program. We can't leave yet.
Okay.
All right, Jill, let's see what questions are out in the community for us.
Oh boy, lots of interest today in the topic and about vaccines. The first question is for Dr. Wishna. When you're talking about the glasses, Jan and Jennifer were wondering, you did answer where to get them, but are sunglasses just good enough? Are my eyeglasses good enough? What's the difference? What do I have to, when I'm shopping, what do I need to be looking for?
So what you want to look for is you have something that wraps around the side. So both of these glasses, they wrap around the side. So probably most sunglasses you would buy do not wrap around, and regular glasses don't. So anything that's safety glasses or safety goggles would work.
Yeah, and there's
You don't have to worry about below or above your eyes?
There's a little bit above.
Yeah, there's a little bit above and below. Yes, that's a good point on all of these. So there's like a little ridge here.
And you can see that when we put them over our glasses, they go over the top.
Yes.
They come back around the side, and don't look up my nose, but you can see it coming underneath my thing too.
Yes.
So it really looks great.
Yeah.
You do
Yeah.
have to clean them occasionally, otherwise they get really dirty like mine are right now. But other than that, they actually they work fine. I wear them every time I'm in clinic, and it's important
I mean,
too.
I think the key is to minimize the free space between the environment and your eyes, and that's what these side, top, and bottom protections do on these safety glasses. You know, for the work environment, eyeglasses nor large sunglasses they do not constitute eye protection. But certainly, if you're traveling and you haven't been able to get true eye protection, I think anything will be better than nothing. So wearing those glasses is going to help. But again, especially in the workplace, that would not constitute eye protection. But if you have that opportunity, please go buy some eye protection.
And besides that, you
look
too
cool.
can look. You look cool, right?
Yeah.
You look cool. And for those of you who are waiting for my Star Trek reference, it begins to make you look like a Borg. And so, you know, how more cool can you be than that?
I was also thinking you could, if you're on a plane, you could wear swim goggles, and if I fly with my kids, that might be what I do because these aren't going to fit my kids. So
Right.
swim goggles, but you'll look dorky, but you won't get COVID, so it's worth it.
All right. Other
Dan wants-
questions?
Oh, yeah, there's lots. Dan
Okay.
wants to know, is there any potential side effects to the eyes or on vision from hydroxychloroquine? We haven't heard that drug in a while.
We haven't. I thought that would have
Yes.
finally gone away. But,
Oh, yeah.
but we know that
There is,
hydroxychloroquine
yes,
is not great
yes.
for your eyes. One
so,
more reason not to
you know,
use
I
it.
see a lot of patients on
Wow.
hydroxychloroquine because it's something that's commonly used to treat autoimmune disease, and obviously we have a lot of patients in the health system with autoimmune disease. So hydroxychloroquine can cause damage to the macula, the center of the vision, but it's a cumulative risk over time, meaning the more you've taken in your lifetime, the higher the risk. And there's almost no risk of that occurring until you've been on it for about 5 years. So, you know, we're not using that to treat COVID anymore, but if you were using it for a short period of time, there really wouldn't be any risk to the eyes. Also, another factor that's shown up to be protective is making sure the dose is appropriate for your weight. So if you're on it and you lose a lot of weight, you may need a dose adjustment.
Emily asks, would someone who contracts COVID through their eyes maybe have less lung involvement than someone who contracted COVID through their nose or mouth?
I don't
Yeah.
think
That's a
so. I
good
think if you get COVID, you get COVID. And once it gets
Yeah.
inside your mucosa, it just reproduces.
Yeah, I would say no. I think, you know, again, what happens is it can be that infectious dose that you get through your eyes. Eventually, we believe, please correct me if I'm wrong, that you drain down into that drains into your lymph nodes and things of that nature. That then gets into your respiratory tract. So eventually, you are going to have that replication there, even if you inhaled it.
Yeah.
That's the big issue of how you can get infected through your eyes, because it, you know, again, it drains down through the lymphatic system.
Yeah, your tear duct drains right
Tear
into your
ducts.
nose.
Yeah.
So that's if you've ever used an eye drop and had a bad taste in your mouth, that's exactly.
Yeah, there you go.
Yeah.
So no help
good
there,
answer.
is it? Yeah, good answer. All right.
Okay, Sarah has a question. I'm not sure if she's asking about COVID or if she's asking about the vaccine, but she says, how would it, either COVID or the vaccine, I guess, affect someone with IIH, idiopathic intracranial hypertension? She said, we already have vision issues, optical nerve swelling.
Okay.
So I did just read about this last night. There have been some cases of patients with IIH, which is idiopathic intracranial hypertension, where
So-
there's
Go ahead. Talk
high
about it.
pressure surrounding the brain, and it can manifest as swelling in the optic nerves and vision loss. And it's idiopathic, meaning we're idiots. We don't know what causes it. But there have been cases of people with COVID, and I think a few cases with the vaccine where the intracranial pressure has gone up. We're not really sure the mechanism, but we also don't really understand why some people get IIH. I think it goes back to the inflammation thing. I think both of those are sort of increasing the inflammation in the body. So if you have IIH, I would still definitely recommend getting the vaccine. Any reaction to the vaccine is not going to be as bad as getting COVID, but you may want to talk to your neurologist or neuro-ophthalmologist, whoever manages your condition, to maybe you need to make some adjustments beforehand or get checked soon after. I would just make sure you're working with your doctor around that time, but I would still definitely get the vaccine.
Thank you. Well, I'm
Yeah.
glad you were here.
Great expert.
Yeah, well done.
Tough
You can come back
questions.
anytime.
It's
Anytime.
And we have a ton of questions today, but I did promise some people yesterday, and I know we're running out of time. So I'm going to dip back into yesterday a little bit, and then everybody today, your questions, if I don't get to them, we'll do them tomorrow. Nancy wants to know, what about some of the claims for RNA-based vaccine technology creating potential adverse events that won't show up for years, like diabetes?
Oh, God,
Get your
that's
crystal ball
just
out.
not it. There's just not there.
Yeah, I'm not sure of those claims. Even Dr. Pollan with these, talked about, these mRNAs, once they get into your body, they degenerate, they get destroyed pretty quickly after injection, and once you get the spike proteins made. So I'm not aware of those claims, and I'm not aware of any evidence, especially from when the vaccines were in trial to the healthcare workers that first got them until now, that there's any evidence that there's going to be long-term effects. We heard Dr. Pollan from Mayo Clinic talk about really by a few weeks you would know if there's any serious adverse events. So
Yeah, I know people I think are nervous that you're messing with DNA. You're not messing with
No.
DNA. RNA is not DNA.
Yep.
It is the DNA gives the RNA picks the message of what to build off the RNA, transcribes that, think of it as a transcription service, and then sends it over to another part of your cell to actually build the protein. Sends the message, takes the instruction,
Yep.
says, go build this protein. The only protein that the messenger RNA that comes in these vaccines can tell it to build is the spike protein. It
Yeah.
can't tell it to do anything else.
No.
And so, no, it will not cause diabetes long term.
All right, Donnie wants to know, if I'm vaccinated, I continue to wear my mask to protect others. What advantage is wearing eye protection? I'm not getting in anyone's face.
Yeah, great question, Annie. What do you think?
Well, I mean, that is a good question. Like I said, for most people in most situations, you don't need eye protection. A mask is plenty. I'm vaccinated. I wear this eye protection because it's very, very, very rare, but you can still get COVID. If you are vaccinated, there's a small chance you could still spread it. My children aren't vaccinated, so that's the main reason. I don't want to bring it home to them. But again, I'm in a situation where I'm 8 inches from 30 different people's face every day, so that's not the same as, most people. I don't know
But
if you have anything
your
to add.
point is the right one, which
Yeah.
is you
Yeah.
can still get it. It may be asymptomatic, and granted, the odds of getting it are markedly less, which is great news. And you're not going to really do a lot of viral replication, but you do a little, and you may still spread the disease. And so you have to think about who else you're going to be around. So the real reason to wear eye goggles, I think, after you've been vaccinated and you're fully protected, is that you're trying to keep everyone else around you safe.
Right.
And there's really, the vaccines look so good. I don't think you have to worry about your personal safety. We have to worry about the people you're around, and that's the reason.
But I think to that point too, I wear it all the time in the hospital. I wear it if I travel on a plane. But if I'm going to the store, picking up takeout, eating out on a patio somewhere, I'm not wearing eye protection. So it's not every day all the same as a mask is. If you go into a grocery store or something like that, you're going to be wanting to wear a mask. If you are eating indoors at a restaurant, you're going to want to go in with the mask, obviously, and once you sit down, most people take off the mask. But in those social situations, you're likely not going to be wearing the eye protection. I think it's more, especially for air travel. But again, in a work situation like the hospital, healthcare situation, I'm wearing the eye protection all the time. So hopefully that clarifies as well.
All right, time for one or two more questions, Jill.
Okay, so I've got one, and I just want to say that the questions today, it's almost like they're trying to stump the doctor. So just beware for tomorrow, okay? They're
They're
really
coming
good
after you.
questions.
We can't answer the eye questions though.
I know.
So
you're going to have to
They'll be
talk to
stumping all the time. So give her all
Yeah,
the stumps now.
I think we're doing pretty good in that regard. We did have a question about VAERS. The place, I guess, what does that stand for again? VAERS, the vaccination care.
Adverse events
Man, I
reporting
thought you were talking about
system.
bears in the woods. I was like, what?
No, not
vaccine.
VAERS.
Bears. Yeah, I'm on
And
top of that
Jeannie's
one.
asking, what is the benefit of VAERS if any of the data, true or false, can be entered? Because it almost kind of sounds like a little bit like Wikipedia.
Yeah.
Yeah, I think the answer to that is that, when you look at it, the information, you're looking for repeated information.
Yeah.
If one person says something that's a little crazy, you're like, okay, that may be crazy. But if it keeps coming up, then you have to investigate it. And so you look for those kind of repeated things. And that's how research is conducted in general.
And I forget what was found after that. Wasn't it I think it was with one of the pediatric vaccines, they found an adverse event that might have been the rotavirus vaccine. You have to correct me on that. But it is to identify things that maybe repeatedly come up that weren't addressed in those original trials, but it's to keep that ongoing data and research so that they can continue, and the CDC or the FDA continue to maintain that these vaccines are safe and the safety and efficacy of those vaccines. And so that's the purpose. And just to your point, I was actually on the VAERS site today, or the CDC website, and they talk about, they do investigate and they do look up these things. So it is vitally important moving forward with any vaccine that this occurs.
All right. Well, let me thanks to Dr. Annie Wishna for being with us today. Hey, first of all, though, before we sign off, a reminder to everyone. What do we have going on in Kansas that changes? You can go anywhere in Kansas and get a vaccine. You don't only have to go to your hometown or your home county. So everybody's open for anybody around Kansas. And if you work in Johnson County, you can get your vaccine in Johnson County, even if you're from Mars or Jupiter or Missouri, which is where I am from, or Iowa or Nebraska or Oklahoma, etc. So make sure you know that. Make sure you get vaccinated. There are 3 ways to make an appointment. Right here they are. First of all, if you are one of our health system patients, you can go to MyChart and make an appointment. Second, if you are not electronically literate, and that's a whole lot of folks, you can call 913-588-1227. That's okay too. And if you're not one of our patients, so you don't have MyChart yet, you can go to kansashealthsystem.com/vaccine, and that is another way to do it. And by the way, just so you know, we are notifying all of our patients that they can come and get vaccinated, and we do that through lots of mechanisms, including snail mail, email, MyChart messages, text messages, and phone calls. We try to reach out to everybody as much as we can. You know how we keep each other safe? We keep each other safe, and that requires a vaccine. Good stuff. Okay, final thoughts from the day.
Well, I think it's great news that the vaccine is now more available in Kansas, so please go get it, and I'm happy to be here. Thank you for having me.
Well, we're delighted you're here. Thank you for being here.
Yeah, thank you. It was great answering some really good questions.
They are. I'm glad. I wouldn't have been able to answer some of those questions, especially that whatchamacallit hypertension question.
Yeah.
Hypertension.
Again, I think we need to stay on the topic of vaccines. We know that there are vaccine hesitant people out there. We certainly want to help and answer all your questions. Please go to trusted sources, whether that's in your community or your physician or your medical team. Try and get all your questions answered, because the way through this pandemic, and like I said earlier, all of the signals continue to show that we do have efficacy against these circulating variants. The way out of this pandemic is to continue to vaccinate and get everybody protected.
You know, we have been saying all along how hard things were in the middle of this pandemic, and there have been a lot of questions. So tomorrow's our Community Question Day. Amanda Cackler, Director of Quality and Safety, will be here with the University for us at the University of Kansas Health System. Hawkeye will be here. I'm not sure I'm going to be here. Actually, I have to go do some clinical work tomorrow morning, but I'll be back with you next week. I remember when we first started, we talked about we have to take care of each other, and the way to do that is to wear masks and to stay protected and to stay safe. And then as vaccines came out, we said, look, we got to start getting vaccinated. I remember we even said, game on, because these vaccines are Patrick Mahomes at quarterback with an offensive line, and it was such a difference maker. And now we're saying, come one, come all. Give us your arms. This is even yet another step forward, because we've got enough vaccine to get everybody vaccinated. Not everybody right now, but over the next few weeks and a month or two. That's an amazing story, because it can be the story of the end of the pandemic. But the punctuation mark to make that true is one thing. and it's you, and it's your arm, and it's your being here. So let's end this thing together and begin a new journey to where we get to go. And when life feels a lot safer and a lot more normal, and there's 40,000 people at the K and 80,000 people at Arrowhead, get it done, Kansas City. Let's go. We'll see you tomorrow.